Okay, so without further ado, yesterday we showed you the problem, which you're all aware. 25% obesity, £16 billion a year for our NHS, and we need a real food solution. Today, I'm going to take you on the journey that is our vision for Elevate, to put PHC front and centre of UK health, where it should always have been. That's our aspiration. So, Elevate's not just a personal wellness app, it's a change in paradigm, it's a change in how we deliver healthcare. And I'm going to take you through that very briefly. So, first of all, I want to establish why we should believe this is possible. Let me tell you about my experience that brought me to this moment. So for 25 plus years, I don't like to count the plus anymore, I've been both a medical practitioner and a health informatician. A health informatician, as my children used to put it, is a doctor that plays with computers. And most healthcare IT is actually built by technologists that don't understand medicine, or by doctors that don't really understand technology. I'm both, I like to think. I'm both a medical practitioner and a health informatician. And as Sam said yesterday, I wrote the first Windows GP system, and I transitioned UK healthcare from text prompts to modern computing. I wrote the first national diabetic audit many years ago, and our software was in every practice in the UK. I wrote the first complete GP system that ran on an iPhone. I designed the Royal College of General Practitioners Research Database. So I've led 3 major healthcare IT revolutions, and I'm going to tell you what the next one is. Because I've seen digital technology transform lives. GPs who went from guessing what their population health was to entire practices transformed by having real data. But here's what I learned. Transformation happens when we can measure intervention. So the first Windows GP system didn't just make computers faster, it made patient data visible, searchable, actionable. The National Diabetic Audit didn't just count diabetics, it showed patterns, trends, and what actually worked. Digital has unique power. Digital doesn't just scale human effort, it makes the invisible visible. Patterns you couldn't see before become obvious. Interventions you couldn't measure become precise. The healthcare IT truth is that every system I've built had one thing in common. It measured what was previously unmeasurable. And measurement always leads to improvement. But digital healthcare still faces one fundamental challenge, and that is one that we've not had the technology to address until now. Oh. The gods are speaking. Okay. So let me take you to Somerset, one small integrated care board. My company provides the digital records for this area, has done for the last 5 years, and we're currently the only healthcare provider in the world, actually, that can read and write data in real time to GP systems, so we can take stuff from your hand into the GP system and back to your hand. And you'll see why this integration matters. Somerset seems quite manageable, doesn't it? If you drove across Somerset, it wouldn't even take you an hour. So surely we can deliver health coaching across Somerset. But let me show you what Somerset looks like in terms of just one healthcare condition. There are 30,000 type 2 diabetics just in Somerset. Remember, this is a small county. It's one of the smallest ICBs in the country. Surely with enough health coaches, we could reach them all. Let's think about that. Let's say each health coach can manage maybe about 100 clients effectively. That means Somerset leads about 300 qualified health coaches. That's 30,000 people times about £200 a month. So for Somerset, it would cost Somerset ICB £72 million a year. So remember that this is Somerset. What happens if we scale that up to the UK? So all of a sudden, it seems that we've got a massive problem. So if traditional health coach can't reach them, what is the plan? What does the NHS think we're going to do about all of these chronically ill people? The national strategy, as we've discovered, as the NHS is pulling back its investment into health coaching, as Helen intimated yesterday, we're having great difficulty renewing some of our TLC contracts because all of the funding is going to these injections. So this is the plan. Ozempic, Wegovy, Mounjaro, the new diabetes and weight loss drugs. One injection, guaranteed compliance, measurable outcomes. It's scalable in a way that lifestyle coaching just isn't. But let's come back to the cost. So GLP-1s cost around about £200 a person per month in the UK. So that's 4 million people times £250 a month. That's about £1 billion a month, about £12 billion per year. So remember yesterday's slide, Ozempic or organic? Well, the national strategy has chosen Ozempic. Medication over lifestyle, treatment over prevention. There has to be a better way. What if we could reach those 4 million people without lifelong medications? What if technology could actually make this possible? Because digital reaches everyone. It's 24/7, it's scalable, and importantly, as I said earlier, it's measurable. Everyone in healthcare knows that patients know what to do, but they struggle how to do it. So who exactly needs the bridge between knowing what to do and how to do it, which is what health coaching gives, and nothing else can give at scale. So let me show you three patients which those of you here who are practitioners will recognise. So we've got Sarah, the knowledgeable struggler. She knows exactly what to do, when to exercise, how to manage stress. She's read the books, tried the diets, joined the gym, but she can't maintain consistency. She starts on Monday, but by Wednesday she's failed. Then we've got Mike. Mike's pre-diabetic. His HbA1 is creeping up. His weight's around the middle. He knows he needs to change before medication becomes inevitable, but overwhelmed by where to start and how to sustain it. And then we've got Emma. Emma's tired all the time. Her energy crashes in the afternoon. She knows it's connected to her food choices, but she just can't face these cycles of peaks and crashes. So different ages, different challenges, but the same fundamental problem. They all need to learn a bridge between knowing and doing, but they need it personalised to their unique circumstances. To solve this, we need both technology that can do both scale and personalisation. Now, we've seen transformational technology before. Let me show you what it looks like. In 2007, the iPhone changed everything. Nobody predicted it would kill entire industries, cameras, GPS devices, music players, or even cash registers. We didn't see that it would change how humans interact with each other. It wasn't just technology, it rewrote social behaviour. Teenagers stopped talking on their phones, started texting. We created thumb-scrolling generations. It changed dating, shopping, even how we navigate the world. And as someone who's built platforms for 25 years, I've watched how the iPhone transformed patient expectations. Patients started expecting healthcare to be as intuitive as their phone. But healthcare apps remained, and often remain, glorified questionnaires and reminders. The iPhone showed us that transformational technology shouldn't just improve existing processes. So last year, having watched it for a number of years, AI suddenly came to life. It became more than just a good idea. And I think that AI is actually going to be the most profound impact of any digital technology we've ever seen. It gives everyone a different experience, personalised to each individual. The iPhone transformed how we communicate. AI is going to transform what we're capable of understanding about it. In healthcare, this is going to change absolutely everything. So, Elevate is going to be at the front of this. It's going to be at the vanguard. Vanguard means those who advance first lead the charge. We're not adding AI to an existing wellness app. We're building AI first from the ground up. The advantage of starting now is that most apps are retrofitting AI onto old architectures. It's like putting an app onto a Nokia. We have the opportunity now to show what we can do with this technology. So, game changer number one is the speed with which you can build apps. This week, my company delivered an AI-powered travel risk service for the blood transfusion service. It replaces a manual system that was letting high-risk travelers through with viruses in their bloodstream that were going to cause problems to their donation. Previously, to develop an app like this would have taken 6 to 12 months. One engineer, 4 weeks, done, delivered. Traditional apps let you set preferences, choose your units, pick your goals. AI learns you, your patterns, your triggers, your unique responses. It's the difference between customization and personalization. Sarah, Mike, and Emma aren't just different demographics. They have different metabolisms, different stress responses, different life rhythms. One size all fits technology just doesn't work. If I was doing this traditionally 5 or 10 years ago, it would be if user type equals X, then show advice Y. That would take forever to work. It's just not possible. But AI software, based on your patterns, trends, and responses, works for you. What would that look like? Well, here's just an example. I notice your energy dips at 3 p.m. after high-carb lunches. Would you like me to suggest some protein-rich alternatives? So, we're going to start small, but think big. With all this AI power, we could overwhelm users with CGMs, micro-tracking, advanced metabolic analysis from day one, but that's not how behavior change works. It's all about small steps, so foundation habits, real food swaps, hydration, basic movement. Build confidence with simple wins before adding complexity. Everybody in this room knows that lifestyle intervention works, or you wouldn't be here. We've all seen diabetics reversed, blood pressure normalized, energy restored, but we can't prove it. That's the real problem in getting credibility. Evidence matters. NICE guidelines are based on pharmaceutical trials with thousands of participants. Lifestyle medicine evidence, case studies, small cohorts, anecdotal reports. We're fighting billion-pound drug budgets with individual success stories. Traditional lifestyle interventions happen in isolation. Patients come in once a month, report progress, we make notes. Between visits, we've absolutely no idea of what's going on. Compliance, triggers, actual behavioural changes, it's invisible. We know it works, but we can't measure it. And without systematic measurement, we can't prove it at scale. And that's the missing piece. So what if we flip the measurement problem completely? Instead of occasional check-ins, what if we captured everything? Every food choice, every energy level, every habit completion. When Sarah chooses protein over carbs at 3 p.m, measured. When Mike's energy improves after his morning walk, tracked. When Emma breaks her evening snacking pattern, recorded. This isn't asking people to log everything manually. AI observes patterns, asks smart questions at the right moment. Passive measurements of outcomes, active measurements of behaviours. Traditional research. How did you feel this week? Subjective, inaccurate. AI measurement, real-time mood tracking, energy patterns, sleep correlation. From memory-based reporting to real-time evidence. Individual measurement is interesting, but when you multiply this across thousands of users, that's when you get population scale evidence. So everyone benefits from this data. You've got individuals who can track their own behavior and improve it. You've got practitioners who we can feed the information to, who can see all of their patients' actual behaviors or the relevant parts of it between appointments. Not how's your diet going, but real data on compliance, triggers, outcomes. Personalised interventions based on what actually works for that individual. Individuals, moving up to the NHS, here's the game changer for healthcare policy. Systematic evidence that lifestyle interventions work, not anecdotal reports, rigorous data across thousands of patients. Individual measurement becomes clinical insight. Clinical insight becomes healthcare policy. So Let me show you what this might look like at scale. Remember those 30,000 Somerset diabetics we started with, the ones that traditional health coaching could never reach? Well, imagine if they were all using Elevate. 30,000 people generating real-time lifestyle and health data, every food choice, every energy level. This would be the largest lifestyle medicine data set ever created, bigger than any pharmaceutical trial, real-world evidence from real people leading real lives. We'd finally have the proof of what works, for whom and when, which interventions work for which metabolic profiles, how long behaviour change takes to improve biomarkers, what predicts long-term success versus short-term compliance. And Somerset is just one small ICB, but it happens to be one that we control all the data for. The evidence base would transform healthcare policy. This isn't just an app generating data. This is the evidence-based revolution that lifestyle medicine has been waiting for. And finally, we'd have the Holy Grail moment. Last year, a number of you doctors asked me to provide a platform for collecting the multiple N=1 trials because you know it's valuable. This is kind of giving you that, but an awful lot more. Lifestyle interventions are really challenging to collect the data for. We have a credibility gap. Doctors prescribe drugs because we prescribe drugs because there's rigorous trial data that drives the NICE guidelines. But suggest dietary change? Where's your evidence? NICE guidelines favour medications because there is widely published body of evidence. Population scale data changes everything. Lifestyle interventions with the ability to collect the same rigorous evidence as pharmaceutical trials. Real-world effectiveness studies with thousands of participants. Peer-reviewed papers based on comprehensive outcome data. Lifestyle medicine graduates from complementary to evidence-based, from wellness advice to clinical intervention. This isn't just about proving lifestyle medicine works, it's about positioning it as a first-line treatment, not a last resort. This is about transforming healthcare from treatment to prevention. So that's the evidence revolution. Let me show you the complete picture. Elevate isn't standalone, it's part of a comprehensive solution. We're not just building wellness apps, we're building healthcare pathways, from acute intervention to long-term prevention. So people start with Elevate if they need to, with Liberate if they want to, they go on to Elevate. So here's the future of health: personal, accessible, measurable, and AI-powered. So I have one more thing for you. I always say this. AI personalization is powerful, but it needs world-class content to personalize. You can't AI curate mediocre knowledge. So we're going to be partnering with the best in all of our areas of intervention. And Katie and Giancarlo Caldesi have very kindly agreed to share all of their diabetes reversal cookbooks to drive the Elevate app. So not only will you have David Unwin in your pocket, you will have Giancarlo and Katie in the other pocket. A world-class cook in your kitchen. Fancy that. In September, I will be running Katie and Giancarlo's wellness retreat as a health coach, which I do every year along with David Unwin. It's an amazing opportunity to learn how to cook real food, walk in the Turkish countryside up in the mountains. It's absolutely beautiful. Elevate is going to be launched at the Wellness Camp this year. Those of you that are there, we're going to be giving you a free lifetime membership of Elevate. So we've still got a few places left there. So there's a QR code. Katie has it there. Sign up if you want to come along and be part of the revolution. So I need your help for this. I can do the technology, but actually we need all of you to volunteer to take part in how we shape this, because we have an amazing community of knowledge here. So, like all technical transformations, all of the stuff I've mentioned is not going to be in version 1. Those of you who had one remember the first iPhone and how it compares to what you have one. This is the first step in what I believe will be a revolution in how we deliver healthcare in the UK and worldwide. So, talking about revolutions in healthcare, moving on to this morning. First up, we have Tom Seyfried, whose book I read, Cancer as a Mitochondrial Disease, many years ago, and what an amazing read it was, and how it transformed our knowledge of the basis of cancer from being not just being a genetic transformation, but actually being part of your metabolism and mitochondrial health. So I'm really looking forward to that. In the UK, Isabella Cooper has been beating a very similar path, so she's going to be telling us of her research in that area, and followed by Matthew Phillips, who again is another pioneer in neurology and the importance of mitochondria. After that, we're going to be having a panel to give a deep dive into this. And in the afternoon, we're going to have a bit of a healthcare debate. So Anthony Chaffee, the world-famous carnivore diet pioneer, is going to be telling us about the real healthcare crisis. Damien Downing, who's my colleague at the British Society of Ecological Medicine and has been doing lifestyle interventions for longer than I care to remember, he's going to be telling us about coherent health. Dave Feldman is going to be telling us the results of the Keto CTA study looking into lean mass hyperresponders. I can't wait for that. It's been something I've been following for the last 3 years. And finally, we have a panel on the future of healthcare. So without further ado, let me hand over to Tom Seyfried to give us our fascinating keynote speech.
Okay, let's see.